Hello guys, we are glad to have you back on our channel. I am Moroundupe.
And I'm Oluwaferanmi.
Yes, today we are giving attitude. Moving on to the story or to the question.
So this is more because we are nurses. Decided to do one for the girls, one for the nurses. So this episode is specifically
for nurses. And if you're interested in becoming a nurse.
When is Nurses Week, sir?
Is it on May?
Is it?
Yeah, it's May.
Okay.
Yeah.
Happy Nurses Week in advance.
Yes.
Happy Nurses Week in advance. We might and might not do another nursing video.
But we try, maybe.
We will.
We can give you another one, you know.
So this is just for us nurses. So it's just talking about nursing in Nigeria, nursing in UK, the cultural differences and changes you experience, we experience as an international nurse and international nursing students. So walk with us, guys.
Yes, please.
So, Madam, this is just Loba.
Yes, nurse.
Ebitomi. Oh, okay, I did it.
Oh, okay. Okay, nurse, I did it. That's true.
So what are the things that like changes from like what is normal in Nigeria but are quite not normal in UK as a nurse that you experience?
Okay, do you mean nursing in Nigeria and comparing nursing, like the nurse?
Yeah.
Okay, I would say nursing is nursing everywhere. That like it's the same practice, but the way you practice it and the law can be different. So, like here in the UK, there are a lot of differences. So you have to do all the exams. You have to be qualified. So it's the same in Nigeria. You have to be qualified everywhere before you can practice as a nurse. But when you get to the ward, you need to do more training so that you can be able to adapt to their system. Like, you know, some people do cannulation from Nigeria. There are some hospitals that I don't think that. Did you do any cannulation in Nigeria?
Nursing in Nigeria, you're not allowed to cannulate. Well, I don't know if
in some private hospitals you do.
Private hospital.
For the
federal normal as a nurse, you're not supposed to cannulate.
No, you don't.
I'll say
I don't even think people. I don't think they have like. That's one difference. Yeah, you have a training done for you to be able to practice, to do some things,
some skills. But in like you rightly said, in Nigeria, throughout our 3 years as a student, we're
not trained on cannulation.
Apart from we're not trained, they specifically told us that it is not part of our job responsibility. In case anything happens, it's on you because NMCN is not going to fight for you, it's not going to intervene because it is not part of
your duty
as a nurse. So I know there are nurses that does cannulation, but
private hospital.
And you can develop the skill personally on your own.
And no training that's one difference.
That's one difference. So
so like you have a lot of trainings to do, like we spoke about cannulation,
even
ECG, vital signs. You need access to those things. You don't just like when you want to save those observations, you need access. Let me say electronica. I think that word is the right word because in Nigeria we do more of paperwork. So most of their things are now in electric. Yes, so they don't do paperwork like we do in Nigeria. So I don't know if it's still the same really, but that's another difference.
Let me buttress what you've said. I would say in the UK you tend more to be on the computer, more doing documentations than being hands-on with your patients. In Nigeria we do documentation.
We do paper. Do you remember when we were in school nursing that we do all this by bedside? Write nursing notes.
But it's always most times at the end of the shift you just write patient clinical like the shift was okay.
You know one line. You know that book that we normally read at the end of the shift.
Of course, that's another one. That's for handover.
Yeah.
But yet, for a patient, it's still very minute. Like it's still total.
Yeah, there's one. No, I remember vividly. If you are seeing Nigeria,
like
please.
An higher education or handbook cover where you write the handover
notes.
But I think they evolving. They're still evolving.
Let's ask our viewers, if you are watching this as a nurse and you are still in Nigeria, please, we would like to know what it's like. The nursing documentation. Has it improved? Is it still a paperwork or is now electronical? Like it's electronic.
Especially the federal hospitals, like the private. Public
hospitals.
Public hospitals, state hospitals. I know private hospitals. Yeah, of course,
maybe
they would have improved, like how to save down the proper documentation. In the UK, documentation, they don't joke with it.
Yeah, that's another thing. Like law, there are a lot of law guiding all you do.
Yeah. And it's evidence-based.
Like we were taught in school, evidence-based practice. So you don't just do anything out of pay. Okay, let me just do it.
Yeah, out of
you have to back up everything you do because your pain is at risk.
There is this procedure, manual evacuation. And it's not a pleasant procedure, but I don't mind doing it. Using your hand to sweep out. In Nigeria, I'm happy to do it. Just double gloves, sweep. Like it's like I do it any day. So in this place, there was a patient that was very constipated that she could hardly sit. She couldn't sit down, and she's quite old. So I felt so I'm empathetic. And I'm like, I feel so bad. Like I'm putting myself in this lady's shoe, and I'm so uncomfortable.
Just want to help. You do a lot of things because I pity you. Let me help you.
Yeah,
but no. Okay.
We've given her a lot of medication just to let her go to the toilet, and it's just impossible. And I went to meet a sister and I was like, sister, so I'm happy to do manual evacuation. Just tell me, go ahead. And the lady told me, looked me straight into that and said, NMC does not that they do manual evacuation under anesthesia, and they do it in the theater, blah blah blah. I was like, it's like you do not understand what I'm trying to say. Manual evacuation.
Is it for enema?
We've given this to my enema.
So you just want to help her to lubricate and
because even with enema, it's just the same thing. I can just put in that nose right.
That's what we are saying. Everything must be prescribed. Like you must have reason why you want to do. You can't just say no. Let me show you.
We've done it. Yeah, we've given enema. We've done everything. It's just
and that's what you want to do. You want to not. You are thinking that maybe let me just do this.
Let me just to help out. Just to do that part. Probably is going to start flowing.
Because if you do it, what if? Because you have to be careful, just like we said.
Honestly,
because if you go and do that one out of pay, I want to help you. The patient might come later in 2 days and said what you did has caused trauma.
Yeah. Like if she was telling me they have to go to the theater, they have to go to the. I was like, it's like you do not understand the procedure I'm trying to. I said I'm just going to go in, scoop in, like it's just as if you are doing because you do rectal examination.
Yes,
anyway.
now
it's just like doing rectal examination, but coming out with something that is just what I'm telling you. That's just what she said no. Like she said no. She called another sister in my presence, and that one said no, they don't do it anymore. So I couldn't. Well, I felt bad. I couldn't help. Well, yeah, that's
the law. That's the law.
But in Nigeria, you don't even need anyone to tell you can or you cannot do it.
As long as you know as long as you know how to do it, and you know that this is going to relieve the patient, or
just go in, do whatever. Like it's so simple.
Even the patient self will be happy.
And you are able to. If you are constipated for a long time, you cannot wee. So you'll be constipated.
And also have retention.
So I was feeling so bad. Well, I couldn't do it though. I couldn't. And for my own safety, the sister told me not to do it, of which I didn't do it. And I had to document it. Well, I didn't document that. They said I should not do it. So I didn't. It was a suggestion. But like I said, in another thing in Nigeria, there's this word they just tell us. Improvise.
Okay, you have to be careful the way you
improvise to the extent you can improvise with your life. Exactly. In Nigeria. You improvise
just to make sure that the patient is like it's just
in Nigeria. But here in the UK, you do if the necessary instruments, necessary thing is not available, you do not do the procedure, you do not, and you document efficiently. Because if privation, anything happens, even if the thing was successful and they realize you do not use the appropriate equipment, appropriate thing for this procedure, you get penalized for it. You are doing something good though, but you still get penalized.
Apart from even procedure itself, I remember like even this is no, I'm trying to deviate a bit from nursing. When we were students that work our 20 hours then. You remember we had some training about how to undo patients that are
PMVA.
going. Yes.
PMVA
so those things I would do. You are trying to help the patient or to even save yourself from trouble. You must make sure that you do everything according to how you were trained.
Exactly.
You cannot say maybe you want to go and maybe you are supposed to do like this to do it, and you want to go and be doing like this. Don't let them catch you, because that like everything is just
a friend of mine.
Everything is right.
During that PMVA thing, when I think we were working, well, of course we were working one day, we did a shift, and she was trying to help. I think the patient was going to eat his head on the door or something, so she was just trying to help. So they were trying to restrain the patient. So she held the patient head this way. She was suspended though.
You can imagine.
For the fact that they didn't even tell her on that day, I think a week after, that's when they told her that during restraining you were bending the patient's head. That what if you went to
eat the head on the...
No, that what if this one disc misses in the spine, thingy. They just made a huge case out of it. The patient was fine. In her own defense, she was trying to help the patient not to eat his head on the wall or the door or something.
Like maybe you didn't handle it the way you're supposed to.
They said that was not how she was trained. No one trained you to do the patient's head like this. And she was suspended for a month or thereabout, and she had to be working in care home.
You can imagine. So
and she was only trying to help. So if you don't try to help in this place, so
yes, so
if you see someone wants to fall down,
allow them to like. Don't try and go and be using your back to. If you like. Let them just go down.
If you know you cannot
you cannot help
efficient, and if the kind of help you are going to help is going to make them
more
dislocation to them,
maybe you want to go and, if you know that you'll be able to like without causing harm to the person or to yourself, that one is so. But if you go and I want to help you and then well, all the best for you.
If you don't know how to use hoist and you say, oh, you've been placed to an environment where they use hoist, there's this kind of hoist, there are different kind of hoist. The day I saw the one that is always on in the ceiling.
Okay, that they have at home, right? Is it?
Sometimes they have it at home, sometimes they have it in the care home, so it's always in the ceiling.
Okay, I've not seen that one. I know the mobile one.
No, it's not that one. This one is attached to the ceiling, so there's a way you hang the slings and all. The day I saw it, I was scared. I had to tell them that I've never done it before. I've never used it before. Slide sheet in we don't use slide sheet in Nigeria.
No, we don't. A lot of things that are different.
Some people might see you as being incompetent. Like if you say you don't know how to do it, it's better they see you as being incompetent.
Exactly. Because if you don't know how to do it, you don't know how to do
guess. Imagine hoist. You don't know how to use hoist.
No,
hoist can go wrong.
Can you even guess hoist? Because you need to know how to operate. Like you need to know how to this one you have to press left.
It's not the pressing that is the problem. It's the you can put the head.
So that's what I'm saying. Now, maybe the control. You can be like maybe it's just left and right. No. Once you go and press left, maybe the thing will go and be. You need to create a balance. So it's you just need to know how to do it.
But in Nigeria, you can use Agbar.
And it's fine if you don't know how to do it. You don't know how to do it. Everybody will understand. It's not like you're not. It's not about being competent or not.
Band 6, band 7s. There are some procedures they don't know how to do, and they don't shy. They don't know how to do. They don't know how to do it. There's nothing you can do about it. If they think is needed for them, they go for the skill training. But if they feel like it's not necessary for them, they don't bother about it. But you cannot say because you're band 6, band 7, it's compulsory you know how to do some procedure. It's not like that. So if band 6 and band 7 are not killing themselves or knowing all the procedure, all the skills, so why will you a band 5 want to know everything? It doesn't work that way.
If you want to get trained, you can speak to them. They can book you for the training.
Yeah,
you have your competence in that area, and then you're good to go.
But you don't just say you want to just go and gamble with. So it doesn't work like that. Like I said, in Nigeria we improvise. You use your intuition all the time. But in this place, it's not like that. If it's not according to the trust policy, if it's not policy, if it's not in trust policy, it's not in the NMC guidelines, RCN, UNICEF,
all the bodies,
NICE, UK, gov.uk, all those things.
All the bodies, like, they just need to.
Anything that you have to go to anything that will make you to be explaining yourself. I think I was supposed to do this.
I didn't do this, so you need to
try as much as possible to avoid stories like that. Well, that is my own. That is why I see.
Yeah, you're right. That's absolutely.
Another one again is working here in newly as a newly qualified nurse in UK. I realized that people tend to look down on you, especially when you are starting.
Yes,
they tend to look down on you.
Yeah, like you don't know how to do this. Like I think it's more like there's no room for, like, when you get to the practical part. A lot of people, the nurses, they don't teach you. They don't teach you. Like, yeah, I've seen their students being assigned, when they're in the clinical area, they are assigned to a nurse that will show them how to do most things. Because most of them, they've learned how to do the cannulation, the cannula. It's just the needs guideline.
Yeah.
On, like, okay, that's book. But now we need to come to the real life. So it's not like they're expecting you to know everything. They will guide you through. Or like where we are from, most time you don't have enough guidance. I don't know, maybe because there's war. So it depends. Like, you don't have enough guidance. Sometimes I think it's because they believe that you should have learnt everything. Yeah, so that's what I'm trying to say. Not on the word, from school.
From school, yeah.
So I think it's because there's a war between both. I don't know, maybe because they're not being paid for that part of kidney. Maybe that's why there's a beef. That's just the reality. That was the way it was when we were in school. I don't know if it has changed, and I believe it would have changed, really, because a lot of, this generation, a lot of people have, it's not like the older generation where you are having beef up and down about every little thing. So it's just different. They will train you. They also have their fault too. I'm not trying to say yeah, they are perfect kidney and no. They also have their faults. So we're just trying to compare both sides. That's what we're doing. We're not trying to look down on to bring down our no, that's not what we're doing. So it's just to compare. It's cultural differences. So it's just,
this one is in professional differences. This one I'm about to talk about is professional differences. Babes, in the UK, all of us are team player. No one is anybody's boss.
Everybody work together. But there are some, this one we're talking about, there will still be some people that will tell you that that's a lie. So we're not trying to generalize this one. They are team player, but there are some places where they are not team players.
No, what I mean by team players is like a doctor, a nurse.
Okay, you mean professional? All the professionals, they work hand in
nutritionist.
Oh yeah, that's
in Nigeria.
That's a very
doctor is more like your boss.
Exactly. They don't answer your opinion about things. They just go like do this, do that. No.
In UK, like you can still. I feel in UK I feel much more appreciated as a nurse, because I feel seen. The consultant will call me to say, okay, how's your patient today? So.
Because you are the one that has been with the patient, exactly. So they believe that it's just their own is just to give represent the plans.
Sometimes that's why there are chats there. They still want to come and have one-on-one conversation.
What do you think about this? Is there any improvement? Like even if they don't ask you directly, at least they would like it's really it's good.
Even as a band,
it's in my workplace. Yes, it's the same. Like
even as a band,
there are some things they will ask you when they do some things. When you do some things and they be like, it's not like I won't say it's not like they don't know their job. It's just a way of making you involved in that person's decision. So that's what it's about. It's not like or something like that. No, they're just trying to make so that you be involved. You feel seen in the whole patient decision.
Work hand in hand, like professional. We are team players. We are team, like you cannot say a band 3 will go and report you to the management.
Yes, so
if you are messing up, a band 3 will report you.
Hey, that's another thing. Whistleblowing. Whistleblowing. Yeah, that's why. That's a culture shock. Professional. I don't even know what to call it, because in Nigeria you can have beef with someone, like be like, why did you report me? Like, it's not necessary, but it's a norm for them.
Yeah.
Even if you go and report some people, I think some people say they don't even see it as a big deal. They believe that I need to do this. It's just the right thing. They don't see it as making you trying to make you look bad or put you in trouble. It's just that is what they've been taught, and that is what they believe.
Transparency.
Yes, maybe patient interest in the like that. I think that's.
Like there are a lot of organizations.
But to you, it will be annoying. The fact that why not just come to me and talk to me about it? Why do you have to go and do
They
that?
avoid confrontations.
So that's what they're trying to do.
Rather send an email.
But Naija, you have to.
You tell them there and then, bro, I don't like what you've done. And what you've done does not make sense and all.
So it's just a lot of differences.
Another difference again is patients are more assertive here.
Yes, so what they want.
Patients know their rights here.
They know all the information. They are not at your mercy because the care is free.
In Nigeria.
Maybe because the care is free, they can do and undo.
A registered nurse did something in my presence. Well, I was a student then, but she's a good nurse. But with that, her credibility as a good nurse just dropped from like 80 to like 20 to me.
What did the patient?
The patient was coughing.
Okay.
He was like, Mama Egbenuso, oh my God. I felt bad.
The attitude.
Attitude.
Another thing, your attitude
professional.
Is like, no.
If professional.
You have to be professional. If you are at work, you are at work. Like you are at
Even
work.
if you are at work, Mama Egbenuso, like, why would you say so?
Respect, confidentiality. You need to put the patient's interest, like patient
the
first.
Patient comes first.
Patient first in everything.
So when she did that,
even when you are stressed, safe. Even if you are in the toxic environment, you still have to be professional.
Last you don't come to work.
Exactly.
Last don't come to work.
Maybe you need a mental health break or something, but you can.
If patient reports you, it's their word against yours.
Yeah, because they have to investigate.
And patients are assertive. They don't want this. They don't want it. Document it. You cannot enforce your belief, your thinking on them. And when we're sorry for always saying, but when I'm in Nigeria, you can how do they say it? Convert a patient on the bedside at the bedside.
But yeah, you have to ask for their
you don't even. Why would you? You don't one thing I avoid. I love Jesus Christ. I preach Jesus Christ to people, but not to patients on the ward. Because
they have chaplains. If they need faith,
them, I will call them.
Yeah, so
I will call them. If it's an imam you want, no problem. If it's a chaplain, I will get them for you. But me preaching Jesus Christ to you, I'm sorry. I cannot put myself at that risk.
Because patients they might be the
one to request for it.
Yeah,
they might be the one to request for that, and the way they are going to twist it, and you will be stunned. Like what?
So like they can be so cunning and stuff. Like that's another thing. At least patients in Niger, they can still be. You can still do an undo, and they will still be like, because they are patients.
Yeah.
So they will still they will still appreciate everything you do. But yeah, some people, they don't even appreciate anything. They just treat you anyhow. You get? So it's just different. The differences is just huge. So we're just throwing out the question to you guys. Are you a nurse in the UK? Are you a nurse in Nigeria? Yeah, that's the word. Are you an international nurse? You just relocated. You've been practicing for a long time in the country. Maybe you are in the US or in the UK. Anywhere you are in that is not Nigeria. Or even if you are in Nigeria, what is your experience like as a nurse? And what are the differences you've experienced since you started working abroad? Anywhere you are abroad, what are the differences you've experienced? Do you have any question for our viewers? What do you want them to tell us?
No question. Just one last part. Annoying part. In Nigeria, there's hierarchy in nursing.
There's hierarchy here too now.
I see
the attitude.
Hierarchy in nursing. I mean hierarchy in nursing.
Like, they cherish respect. You must respect me. You must stand up for me. You must sit down for me. You must. Yeah, I understand that one. I think it's just cultural. It's just manners. To them, they believe that because I'm older than you, it's just normal for you to respect me, which is not the same here. These people don't. They don't care about respect. No, they don't. They don't.
You respect each other.
Our definition of respect is different.
Yeah.
Because you call me auntie Dupe, auntie this is respect to some people, but to these people, they don't even call them. They can call their mom.
They call their in-laws their first name.
So that one is not a big deal at all to them. So I think, I understand what you're saying. Like Nigeria, they cherish
like your
respect,
is it DNS or what did you call the matron? The matron will be in this thing and you are seated. Who are you? Stand up, my friend.
Up, exactly, which is not the same. If we find a seat, it's fine. If you can't find a seat, you stand.
That's why they said there's hierarchy in nursing all the time. So
in Nigeria, nurses, they cherish respect. They want you to respect them. So that is just it. I think it's not even about the profession. It's about the culture. You're Yoruba. baby Lancy, come here and see you. When you see elderly people that want to sit down, as a young person, stand up for them. So it's just what they believe in. So I think they are not trying to incorporate into the profession. So that's to the hierarchy, but nobody really cares about do you stand up for me, come here.
Myself and my matron,
we will do the same job. Yes, and like
she's just one past me.
Like everybody is active. There's no repete somewhere because you've been in the profession for 20-50 years. Who cares? You do the same job. Like because you need to. Yeah, you need.
In my previous work, my manager told me that she prefers bed baths than medication round.
That's it. That's a lot of carrying, though. Yeah, I know that. No, that was
that is for you to know that she does everything. Care. She does everything as a sister.
We are not trying to praise anybody here because we know there are good sides of being abroad and their bad side also. We are just trying to state the obvious here. Yeah, it's not like we're trying to praise one and downgrade the other. No. That is not our intention.
No, of course we praised Nigeria for when we talked about
trained and everything.
The fact that you use your intuition in Nigeria, you can use your intuition and just so that you are not covered, but in UK, even you use your intuition, you still get in trouble. Even if that thing comes out positively, you still get in trouble. So it's just the pros and cons. What I noticed, like I can't do and get
away with
in Nigeria. I cannot do them here in the UK. And there are some things, there are practices I can do in the UK I cannot do in Nigeria because I cannot use all my time to document it in Nigeria. Like they are going to call me lazy.
Yeah, that's
if I put the amount of time I document here and I go to Nigeria and document it there, it's going to be a problem. So that is just the pros and why I experience. Now I wouldn't call it pros and cons. It's just
we're just stating the opposite. Like we asked the question. The question is just to compare both. We are not trying to state maybe one is better than the other. It's just to compare the cultural shock, what we've experienced that's different from what we expect where we're coming from. So guys, don't forget to put in the comment section. This is for nurses and those that are aspiring to be a nurse. Put in the comment section. We want to hear your opinion. What has nursing been like in the UK? Are you enjoying it so far? Do you have anything to say about it? Have you experienced any cultural shock?
And this is because we are talking from UK POV. If you're in the US, Australia, wherever in the world you're practicing nursing, medicine, any healthcare related program, and you're an international professional, just let us know what challenges you are facing. What are the things like you like? In Nigeria, I missed my Nigeria thing. If it had to be in Nigeria, it would have been easier, or it would have been tougher. It would have been. Just give us some.
Maybe the workload is better in Nigeria than So just let us know. Just tell us, please.
One thing I know is the workload is the same. You know when we're they're like a nurse to 2 patients. They play
in the book
a nurse to 4 patients. In this place I've looked a nurse to 14 patients.
Yes, so
if you are not careful,
that's for you guys. So put what have you been experiencing in nursing since you've started? So tell us, okay? I think that will be all for this episode, guys. And thank you very much, and we hope to see you in our
next video.
Cheers.
See you. Bye.